Hello everyone, my name is Mei Lau. Today I will be presenting on contact dermatitis, a common skin condition that arises from exposure to irritants or allergens. This presentation will review its clinical presentation, diagnostic approaches, management strategies, and key aspects of patient education. Patients typically present with a sudden onset of pruritus and erythema. The rash usually develops at the site of direct contact with the allergen or irritant. The pattern of the rash can provide clues to the specific trigger. For example, linear streaks are often seen with exposure to plants such as poison ivy. The top image illustrates contact dermatitis under the eyes following the use of a new eye cream, while the image with blister depicts a classic reaction to poison ivy. Diagnosis of contact dermatitis is generally straightforward. Though patch testing can be utilized to identify specific allergens, biopsy is rarely required but may be helpful in atypical or unclear cases. Avoidance of identified triggers remains the cornerstone of treatment. The image above demonstrates patch testing, where more pronounced redness indicates a stronger positive reaction. While skin biopsy is uncommon, when necessary, various techniques such as shave, punch, incisional, or excisional biopsy can be employed to obtain a sample for further evaluation. Mild to moderate cases of contact dermatitis typically respond effectively to topical corticosteroids. In contrast, severe or extensive cases may need a short course of oral corticosteroids. Antihistamines can be used to alleviate pruritus, although they do not address the underlying inflammation. Patient education plays a crucial role in the management of contact dermatitis. Proper application of topical corticosteroids include using a thin layer and avoiding sensitive areas such as the face and skin folds is essential to minimize adverse effect. Patients should also be advised to avoid known irritants, including strong scented soaps, harsh detergents, and metals, to prevent reoccurrence. Alternative treatments such as oatmeal baths, aloe vera, and coconut oil may provide symptomatic relief and support skin healing. Antibiotics should only be considered if a secondary infection develops. Although contact dermatitis is generally a localized dermatology condition, chronic or recurrent manifestation can substantially affect an individual's overall quality of life. Persistent erythema, pruritus, and skin lesions may lead to significant discomfort and sleep disturbance, which can in turn contribute to mood alterations, including anxiety and irritability. Furthermore, ongoing symptoms may impair daily functioning, reduce work productivity, and limit social engagement. The impact of these physical and psychosocial effects underscores the importance of timely diagnosis, effective management, and patient education to mitigate long-term consequences associated with chronic contact dermatitis. With appropriate therapeutic interventions and strict avoidance of identified triggers, the majority of patients demonstrate prompt clinical improvements. Follow-up evaluation within 1 to 2 weeks or sooner if clinical indicated is recommended to confirm complete resolution of the dermatitis and to monitor for any potential complications. Thank you so much.